Good evening, everyone. Good evening, ATP mommies, ATP daddies. Good evening, ATP uncles and aunties. Good evening, ATP guardians. We thank you for joining us on the second day of our online conference as we continue to mark the 50th anniversary of Ask the Pediatricians. Hello? Okay, hi everyone again. I'm sorry for that break in transmission. Thank you for joining us on the second day of our online conference. I had a bit of internet issues, but everything has been sorted now. Thank you for joining us again. Today is the second online conference, and we are talking everything COVID-19, everything coronavirus. We are discussing living in COVID-19 pandemic. Living in this pandemic is our new norm. And today I have a co-host, and I also have 4 other professionals who are waiting behind the scene to tell you everything that you need to know on how we're going to live henceforth. So first of all, I'm going to welcome my co-host, and her name is Dr. Anene Nzelu.
Hello, everyone. Good evening. It's good to have you here today. Another interesting session of ATP. ATP is always very interesting. We all know that. So we're going to have another interesting session with 4 very interesting doctors who will be leading us through this, how to live in this new norm, in the pandemic that is currently ongoing, and how to navigate the waters as we continue to improve our children's health and our health. Welcome once again.
All right, so the first person that will be speaking to us is our very own Dr. Vera James. She is an educational consultant, and she has a Doctor of Management in Education. Dr. Vera, thank you for joining us today. Please.
Good evening, everyone. Thank you so much. Thank you so much for having me on board. I want to say happy anniversary to Ask the Pediatricians Foundation. And thank you so much, Dr. Bride, for this opportunity. Right. Thank you, Angela. Thank you for having me. I said that before. All right. So let's talk about COVID-19 and school resumption. Well, I was asking myself, what exactly are we going to talk about? School resumption. Which school is resuming? Which school has been on holiday? So I'll just simply say that what is important to us as parents, as individuals at this time, is that learning should take place. And for me, this is beyond having lessons in classrooms or whatever. Anywhere in the world, everywhere, even in your bathroom, you are learning. So it's important for us to get that clear that any activity that is capable of bringing about a change in the behavior of one through experience is learning. And this can be done anywhere. Recently, I saw a guideline. The government gave us guideline about the minimum standards to resume. And I saw some stuff on outdoor learning, platooning, staggered attendance, alternate attendance. Well, these things are not bad in itself because, okay, like I said, when I saw the document, I said quite lovely. But the next question we want to ask ourselves is how attainable will this be? Even the people who wrote it, fine. It's obvious that it was written by specialists, by experts and all that. But the truth is, what do we have on ground? We as the people, what do we, can you hear me please?
Well,
Yes.
Right. Okay. So what is on ground? What do we have on ground? What is are we ready to really go back to school? I remember when I was supervising the teaching practice experience, and I saw how much even government teachers could not even practice what they were taught in school. For example, when you are teaching, you're supposed to go around the class, see whatever is happening with your children. But when the class on its own is already filled up, how do you want learning to take place? How do you expect the teacher to go around? And then you're telling us to go back to school. It's a bit too clumsy. It's a bit too confusing. Even though it is said that, okay, certificate exam classes should go back to school and all that. How ready are we? We're looking at 31,000 cases today in Nigeria. And then we're talking about, okay, washing your hands, disinfect yourself, face mask. How many of our children can actually do all of these things? How many of our children, well, the doctors are here, so they would advise us as we go on. How long can we have a face mask on a child? So, something came to my mind. I was just thinking about this kind of scenario where you have a child coughing in class. Normally, as a teacher, when you want to cough, we tell our children, just, that's fine. But imagine us going back to brick and mortar school right now, and a child just mistakenly does this. The next thing is everybody will begin to laugh. I mean, as a teacher, for teachers who are watching this show right now, they would understand what I'm saying. It's a bit not too workable. You want to now begin to address the children and say, okay, don't worry, we'll be fine. Okay, what if one of the teachers become infected, in quotes, and then you have to quarantine such a teacher? So what next are you going to, what would we do? So I'll just say, this is just me talking. I'll just say, let's keep learning and let's ensure learning is taking place even in our homes. So your online learning is fine. WhatsApp, phone calls to your teachers, technology tools, perfect. That's okay. How about schools who cannot do this? We have worksheets, we have exercise books, we have textbooks. So schools are beginning to look for means of communicating with their parents and their children. So what I would advise for you as a parent or for the school owners or whoever is watching this show, just do whatever works for you, whatever works for your community. And then, like I said earlier, speaking about learning, there are other things we can learn in this pandemic. Washing, cooking, gardening, weaving, sculpture, there are a lot. And then one thing that we must also remember is that education in itself has a value. And the value of education is such that every child, every individual is useful to himself and within the environment where she stays or he stays. So if your child right now is being useful somehow, then your child is learning. If your child is learning something from you, then your child is learning. I'm not saying learning to write and read is not as important. It is. But what I want to advise or counsel parents today is just make sure you are intentional with your child. Make sure the children are learning something even at home. They do not have to be in the building of a school to learn. Now, I understand the place for social interactions, and that's very key. And so that's why I'll just share what I have, just a few things to tell parents. First thing you want to do as a parent now is to take charge of your family, of your home. Be the government of your house, be the government of your children. Decide what you want your children to do per time. And then one other thing is that you must be able to speak to the heart of your children. Children are home 24 hours with parents, and some parents are on their laptops, on their phones, working and doing stuff. But it's important that you have time, you spend time with your children, you listen to your children, you hear what they have to say. Remember, they do not have friends now, in quotes, that they can speak with, although we'll still talk about staying online safely. Another thing you want to do for your child is you want to be responsible for that child's learning. You want to put a structure around the learning in your home. Okay, I'll say this. sometimes when the pandemic started, I found out myself, inclusive, that I kept my children just doing one work, one learning or the other, and sometimes we don't close shop. But the truth is, parents, please put a structure to what you're doing. There is always an opening time for school and a closing time. So even if the children are in your house, let them wake up, get ready, get a very safe environment for them to read or to do their online classes or whatever it is they want to do. But be sure that you keep your structures in place. Now, there's another problem that we're looking at. If you allow, if you, some children I understand now watch TV throughout the day, some are reading their books throughout the day, and there's no balance anymore. So I want to advise parents, if learning, for now, learning is at home, and I want to also subscribe that learning should remain at home. Wake up time should not change. Sleep time should not change. When you're done with school, end school. No distractions. Don't help your children. I'll explain this. Some parents try to, so I know some schools did some form of assessment in the course of the term. And then some parents, you hear parents, sometimes we go into school platforms and we hear things, we laugh. Not very funny, but this is just for you parents. You don't have to, this is not a term for prize giving day or I came first or my child came. No comparison. What you want to do for your child is just allow your child learn at his or her own pace. Don't teach them answer. Don't tell them, and that's the answer. That's not the answer. You also want to make them safe online. We cannot overemphasize this. There are secondary school students, especially the different WhatsApp group that children have found. Please, I want to just suggest to you, parents, if you're listening to me this evening, take your children's phones. Check WhatsApp group. You need to be sure that your children are safe online. If they cannot be safe online, then please ditch the phones. Ditch anything. If you know that you have not gotten to the point where you have gotten mastery of that. There are different software that you want to try out. It's very important. But please also make sure that your children have their playtime, because it's important that they play. Seek support. Ask teachers. Leverage on your relationship. You have friends who are teachers. So when you get confused, pick your phone. Hello, please, can you just assist me with this? I'm having this challenge with parents. There are things that you can do. But one thing I want to finally say before I think I'm over talking, is that as much as possible, understand that there are three domains of learning. We have the cognitive, we have the affective, we have the psychomotor. Now, many times when our children go to school, in some schools, everything is about the brain. But now your child is with you at home. You have time to teach your child emotional intelligence. You have time to teach your child attitude, behaviors, values. Don't waste this opportunity. Many of us will waste this timing. But if you want to listen to me tonight, what I want to suggest to you as parents is, do not waste this time. Spend time with your children, helping them build their emotions. Spend time with your children, listening to them. Spend time with your children, helping them with their psychomotor skills. Now, if that is all you achieve in the course of the pandemic, I think you have done well. Nothing is missing. When we get back to school, if we ever, of course, we'll get back to the brick and mortar school, the cognitive aspect will still be met. However, you have done your own part as a parent to help us build the total child, because the total child is a child who is beyond being cerebral, but a child who is humane. And the only way you can teach this is not only through a structured school system. You can do this in your homes. So I'm encouraging you parents today, please, as much as possible, help your children learn, make their head learn, make their heart learn, and make their hands learn. I think I will end on that note. And I was going to say this as well. Please support your school. I've had parents call me and tell me, oh, my school owner is doing X, Y, Z. I don't want to go back to that school. I don't want to. And I was telling my husband, I said, if I got a penny for every parent I helped, every client I maintained for a particular school, maybe I'll be rich by now, because parents busted. And so, but please, this is the time. There was so much outburst, sorry. But this is a good time for you as parents to build a relationship with your school. School owners, build a relationship with your parents. If we all agree that this pandemic is a collective effort of everyone, then we'll be making a headway. I think that's what I'll just say. But for school, No. Let's look at them blended learning. Let's forget about going to the brick and mortar school for now, until at least we are sure that we've been able to what's the word now, manage the virus in Nigeria to a very, very sensible level. I think I'll stop there for now.
Okay,
Thank
thank
you
you
so
very
much.
much.
So much passion, so much fire. Dr. Vera, for what are we going to vote for you for? For Minister of Education. Thank you. So just to recap, she's mentioned a few things. What works for you? Go with what works for you. Take charge as a parent. Be decisive. And she mentioned three very big English, which we'll come back to. She said there are three domains of learning: cognitive, affective, and psychomotor. We'll come back to that so that you break it down in simple terms that we will understand. Thank you so much. And as we go on, I would like to introduce, you've seen two more beautiful faces and one very handsome face additionally have joined us, and we would like to introduce them. So we have Dr. Olatomi Bamiboje. She's a consultant pediatrician and immunologist. She has interest in respiratory pediatrics with over 11 years experience. So we're just going to introduce all the rest of the speakers. Each of them will say hi to us, and then we'll take it up from there if that's fine. So Dr. Bami Boje, please can you just say hi to us, and if there's something I've missed in your introduction, please just can you slip it in? Thank you. Sorry, we can't hear you. If you're muted, can you unmute yourself?
Good evening.
Good evening. We can hear you now.
Yeah. Happy anniversary, ATP.
Good evening.
It's wonderful being here this evening. That's all.
Thank you. So the next is Dr. Ulonam. She's a consultant pediatrician with interest in pediatric neurology and developmental pediatrics. She's got over 15 years experience working with children in various capacities. Dr. Ulonam, can you say hi to the house?
Good evening, everyone. I'm so glad to be here today. Happy anniversary, ATP.
And we have Angela.
Okay, thank you. And the very fine gentleman in our midst is our ATP physician guru, Dr. Rotimi Adesoyan. He is a family physician with a postgraduate training in family medicine, and he has certifications in public health, hepatitis management, and family planning. Dr. Rotimi, you're welcome. Thank you for joining us today. Please say hi to the house.
Thank you very much. Happy 5th anniversary to all our volunteers and members out there. It's a great evening.
All right, you're welcome, sir. So Dr. Rotimi is the next speaker, and I will be sharing
Thank you.
His slides with the house now. You can go ahead, doctor. Share screen.
Okay, good evening, everyone. I will say happy 5th anniversary to all our volunteers and members out there. I want to appreciate the founder and the CEO, Dr. Gbemisola Boyede, for this rare privilege and opportunity, to share with the house. So today we'll be looking at the coping strategies towards this COVID pandemic. As far as mental health issues is concerned, we all know that the COVID-19 pandemic, is a global emergency. It has spread worldwide, and this is the first time that most of us will be experiencing the pandemic. I guess the people that experienced the earlier pandemic in 1918, they are no more. Maybe one or two may still be around. But normally, pandemic is a very stressful event. It's not something we hear every day. It's a very stressful event. And for every stressful event, There is something that is conditions that normally follows it, and mainly the mental health issue. That's what you'll be looking at this evening. Next slide. Okay, let me move on. The COVID-19 was brought into Nigeria sometimes in February, towards the end of February, by an Italian man. Since then, government have started several strategies, including the lockdown, and most of us, because we find ourselves being locked down, as a result, there are a lot of other things that follows our being locked down. We are unable to express ourselves. Many people were unable to go to their respective places of work. Many people were unable to do what they are expected to do, And what this pandemic, has done to us as far as mental health issue is concerned, I've broken it down. I first talk about those that are already infected, or those that have that we say suspected case, or those that we are suspecting might have had the case. They present with mental problems such as anxiety, denial, depression, loneliness, anger, insomnia, and so many. Those are the ones that are affected. It also affects the family. You can move the slide. I think I'm on the third slide now. You can move the slide. So we have the citizens of the country. You can move the slide to the fourth or fifth or so. We have the citizens of the nation that have also been affected, by this mental health issue. Because people are not used to staying indoor. As a result, many people, have been trapped indoor. As a result, there is a lot of anxiety. Some there have a lot of irritability. I'm sure we've heard over the news that the mental cases have increased over the last few months. We have seen, so many suicidal cases, that has happened in the last few months. But for family members, the family, is a very powerful tool in the society. That's what we call post-traumatic stress disorder. This normally accompany every stressful event. Like I said earlier, that the COVID-19 pandemic is a stressful event. So we have what we call post-traumatic stress disorder. It follows every stressful event, even for some medical condition like those that have surgery, or for every illness, there's one thing or the other that follow it. Mental health issues. Most people may not be able to coordinate. They may have what you call amnesia. They may not be able to remember some things that have happened in the past few days or past few weeks before that time. And a lot of family are going through this post-traumatic stress disorder now, mainly because some of their family members have been infected, and those that have not even been infected, they've had one extended relation being infected or the other. Some people have not had cause of any, as a result. They are also facing this post-traumatic stress disorder. But for we health workers, next slide, for we health workers, we have had this challenge. Some of our colleagues, have been infected. Some of them, they have what we call burnout syndrome. A lot of them are having sleep disorders because some are having fear of this COVID-19. Some have actually been infected. And as a result, there has been a lot of emotional disturbance, a lot of our sleep disorder, a lot of our depression, because COVID-19 is not a good thing for anyone, even the doctors who have. Then going back to the post-traumatic stress disorder, even the WHO have said, that many physicians, we developed this at one point in time during this pandemic as a result of the stressful nature of the job and as a result of how contagious the illness is. So, but we believe that once we are out of the pandemic, our health workers too will also be out of this. So, we move to the coping strategies, how we overcome all these mental health issues. I've just summarized it. There are more than this, but those are the basic ones that people are facing now: depression, post-traumatic stress disorder, anxiety, emotional disturbances. These are what people are facing now. As a result, there is need to develop coping strategies. Coping strategies are simply, they are psychological patterns that individuals use to manage thoughts, feelings, and other actions that may be encountered during this stressful period. This may help a person to face such situation in life, but today the coping strategies we are more or less is towards the mental health issues. I've listed them. The number one of it is to connect with other people. During this period, we need to connect with other people. The fact that they have said we should do social distancing does not mean that we should be socially isolated. We should get across to our family members, to our loved ones, to our co-workers that we have missed for some time. We should get back across to them, and get in contact with them. So that's the first coping strategy. We need to connect with others so that we may live a healthy life. Number two, we need to take a break. Like some of us that are doctors, especially those of our colleagues that are the forefront. Some of them have been away from their family for many months. Like a colleague told us that the husband has been away for over 3 months, because he's at the forefront. So we need to take break, and other people too that also at the forefront, they need to take break time to relax, to unwind. It's also a coping strategies towards this COVID-19 pandemic. And for those of us that have been at home, that are anxious, that are facing anxiety, or are facing one issues or the other, like the post-traumatic stress disorder, we need to try and take deep breaths and look for activities, that will get us engaged. The number three is to take care of our body. We need to eat well. We need to take balanced diet. We need to take a lot of fruits and vegetables. We need to avoid alcohol, and to sleep well and to have enough rest. We need to take balanced diet because we need to boost our immunity. Because one of the things that we need to overcome this virus is to have our immune system, in the right amount, at a very high amount. So we can always get that from fruits and vegetables, and we get this by doing by eating balanced diet. Then we need to be thoughtful about staying informed. We need to listen to the news. We need to listen to authentic news. There are a lot of fake news these days on the social media. We should not imbibe in those ones. We should not listen to rumors, like all the negative rumors that people have been saying that COVID-19 is a scam and the rest. We need to be thoughtful and listen to news, informed news. Then the number 5 is to avoid comparing ourselves with others. During this period, some people are actually doing well. Some people have multiple means of income, while some don't have any source of income at all. We heard about the cases of private school teachers, that have been, some of them have not been paid for months. What they've been going through now. For such people, they are not to compare themselves with maybe their colleagues in the public who are getting pay and the rest. They need to be focused and also to try to look at other ways, of making revenue, because there are many opportunities these days. Then we need to accept imperfection that come with this COVID-19. The COVID-19, there's a lot of imperfection from it. A lot of people are not doing well. I go back to a private school teacher. I remember a man that was crying on the TV one time like that, and many other people, with negative news and the rest. But we should look at the positive side of it and look for how we'll be able to achieve, greater feats. We should not just believe on all we see on the social media, on Instagram, we should not just believe on all those ones. Then number 7 is that we need to seek help when help is needed. Some people have actually died during this COVID-19 because, some of them, after they were infected, They just decide to stay indoor. They did not seek help. They did not speak to people that are around them. We need to, as a coping strategy, we need to seek help. We need to talk to the health workers around us. We need to speak to our friends. We need to speak to our family members. Like I said earlier, that social distancing does not only mean social isolation. So as a coping strategy, we need to do that. So I will move to the do's and don'ts. I've listed these about 9 or so. The do's, we need to have positive thinking. It's more or less a summary of the 7 coping strategies I mentioned earlier. We need to have positive thinking. We need to do regular exercise, eat balanced diet, like I've said. We need to have relaxation techniques. We need to do regular daily routine. We need to socialize, meet with our friend online. We need to imbibe healthy lifestyle, and we also need to take break even from work. And the do's, we should avoid substance abuse. We should not say because of what we are going through, we indulge in alcohol. We should not eat too much. I know that the fast food are on. People can easily order from the nook and crannies of their home. They can easily order fast food, but we should not let this one be too much. Then we should engage in online. We should avoid engaging in excessive online activity. Things that make us to be sedentary, we should try and disengage from them. We should not believe in all this fake news and the rest. Then, in conclusion, I will say, as part of the coping strategy, we need to make appointments with our friend to meet, for hangouts on the Zoom, to have a virtual meeting, like is one of also what ATP is also planning as a coping strategy. Towards the last day of this 5th anniversary, we have ATP hangouts, which is going to be on Zoom. We have ATP party, which is also going to be on Zoom. These are the things that we can use as a coping strategies that will help us, to totally overcome this thing, this pandemic, in the spirit, body, soul, and mind. Thank you.
Thank you so much, Dr. Rotimi, for this wonderful presentation. So just to recap again, so if those of us who are listening or those who have just joined, he has stated the impact of this COVID-19 on everybody, and he has alluded to the fact that it affects everybody, the community, those that are infected with the virus, those that are not infected, and the healthcare workers who take care of these things. And he has mentioned things like post-traumatic stress disorder as the impact, amnesia meaning that they forget things. Mothers, please don't forget to feed your babies. So they forget things. Some of them have burnout syndromes, they can have sleep disorders and different things. And some coping strategies which he has mentioned include connecting with each other, just like we're doing now. We're building community as we're talking, as we're sharing, taking a break from work. Sometimes you need to take care of your body. You need to find things that make you happy. Like I have whimsically dressed today for this thing. See, I'm coping very well, and ATP is helping me to cope, and also to stay positive. So these are very salient points that I thought that we should mention. Okay. So thank you so much, Dr. Rotimi. So we're going to go to Dr. Bamiboje, and I would like to direct a question to her. We're already getting questions, and Dr. London, get ready. One of the questions seems to be for you. And but let me quickly let Dr. Bamiboje speak. Dr. Bamiboje, please, can you tell us the impact of this thing on neonates whose mothers are positive, and particularly on their nutrition? So a child who is born to a mother who is positive, what's the impact on that child's development, particularly the nutrition of that child?
Okay, for now, for the experience from colleagues that have handled such cases and discussion is that they could still breastfeed, okay, depending on how stable the mother is. So a mother that is stable after a delivery could breastfeed with precautions taken. And if the mother is able to breastfeed, then that's going to give the child a good start off. But when you have a sick mother who cannot breastfeed the child, then you need to do formula feeding, that's breast milk substitutes, and that comes at a cost. So when you have to go for substitutes because of the poor, very poor health of the mother, then you're going to have to do a whole lot of having to buy formula. But for mothers who are symptomatic, coughing and all that, there needs to be a lot of barrier between them and the parents. They could actually be advised to express their milk so that the baby can be fed, so that the contact between them and their babies are quite limited, and the babies do not end up catching that from the mothers.
Okay, thank you. Thank you very much for that directed question, for the answer. And I'm sure it has handled some of the concerns that people have. But we would like you to take a few more minutes and go on and give us, what do you think, what is the impact of this COVID on children? Take, in Nigeria, what has been the impact on children particularly,
Okay, so
being
I've
a
been asked
consultant
to talk
pediatrician?
the impact on children. Most of the children
Generally.
are at home, like Dr. Vera has said, the children are at home, there's no school. And so that's going to lead to my topic. Children that are used to going out, not staying indoors most of the time, coming back from school, are now confined to a closed environment. Most of them have to stay in their houses. And when children are at home, we usually think that the home is a very safe haven. But we find out that the home is a safe place with many hidden dangers that we don't see. And many people have not gotten used to the fact that they need to keep their homes very safe, to make it a safe place for the children to be. So the children are at home. One of the lucky things is that I think there are a lot less of infectious diseases now among the children, because they are staying in their houses, they are not going to school, so there's no coughing and passing cough to one another. The respiratory tract infections and all those things have reduced. But the thing we are going to be having is the fact that they are at home, they are not kept busy, they have less supervision, so you're likely going to be having a lot of home accidents. They are being adventurous, they want to jump, they want to do so many things. So those are the things that we are seeing. And then for children with chronic illnesses, I know some parents that have reported issues about having to access care, especially those that want to use the public places. They go there and they are turned back, or they cannot access care. They are told to go from one place to the other. So access to care has suffered some setbacks because of the COVID issue. So I think I'll just go to the topic, handling home emergencies during the pandemic, which I'm supposed to talk on. I've given a brief background. So we have the peculiarities of the pandemic, the lockdown. During the lockdown, nobody was moving anywhere. Schools are closed, so they're spending longer hours at home, which I've said seems to be the safest place, supposedly, but we have many hidden dangers. The hidden dangers are as little as an electric socket that is left opened, a bucket of water that is left opened, a child that just wants to jump, the railings in our houses that are not well covered, and children are being allowed to play there. So we also have issues with access to prompt care that I've mentioned. We have parents that have gone back to work after the lockdown. So most of the children are left with inadequate supervision at home. And then there is hesitancy to visit the hospital on the part of many people. So even when they are having a lot of issues, they are still not getting to the hospital. To the hospital because they are afraid of contacting the virus. And so when some of the children come, they are actually bad. They self-medicate to get things by themselves. So what are the preventive? So because of this thing that we have a lot of home emergencies that could happen. What are the home emergencies? I'll briefly go through this. We could have it as simple as febrile convulsion. A child has been having fever, suddenly starts convulsing. It could be scary to the patient, to the parents. To those parents, it's an emergency. We have accidents because of the things I've listed, and the accidents will range from falls to choking, to drowning, to burns and scalds, electrical burns, to poisoning. And then we could have some emergencies arising from medical illnesses. So how do we anticipate this, and how do we prevent them? Because when it comes to most of these things, prevention is very key. Just one accident could cause the loss of the life of a child. Just one could cost the life of a child. And so we need to be very, very anticipatory in this. So how do we anticipate this? The first thing is that we need to prevent accidents. Let's keep the home safe for the children. As many parents that you have your children at home, it will be good for you to just go around your house to do a safety check. What are the things that if a child is exposed to in this house could cause an injury? What are the things that could cause an injury? It ranges from, like I've said, the water that is over there, toys that have small parts that the children could choke on. It ranges from the electric house. It ranges from falls. You have staircases. It ranges to burns. So they are not at home. Maybe an older child is being asked to do something for the younger children. They are exposed to the kitchen. We need to prevent this. When they are in the kitchen, they will be with supervision so that they are not exposed to burns. They are not exposed to fire. We need to make our own guards on our staircases, and anywhere where there are stairs, you need to place guards there so that children don't wander there and then get into having an accident due to fall. And then when they fall, they could have head injuries and a whole lot of things. The second thing is that preventive and anticipatory measures is to have
Oh, we lost her. Technology, we will get back. We will win with 5G or 4G or 4.5G. She will soon be back. So do we give her 2 seconds to come back? Or we can move on to, yeah. So for want of time, while she tries to reconnect, can we move on to Dr. Ulonam? Dr. Ulonam, welcome once again. We'll be happy to hear you share with us your thoughts on this COVID-19 pandemic, the new norm. Dr. Lonam, I think you are muted. While you try to unmute yourself, we would like to give credit to Pick. So you see, I have my props by my side. I have a glass of milk. I have some, what is this thing called again? Yogurt, no vex. You see, I have my teacher, Dr. Vera. Please, what is this thing? Glasses. You see, I need to learn. This pandemic is making me amnesia. Dr. Rotimi, I seem to have been forgetting a lot of things. See my biros, see red, blue, black. But most importantly, we want to give credit to Peak, who has graciously sponsored this program. Cheers to Peak. Dr. Olonam, can we have you? Thank you.
Okay, thank you once more. I want to say thank you to Dr. Benisola Boride for this beautiful platform to educate our mothers and help people cope with the challenges that we're facing right now. And for having me, I'm very grateful. I've been having a beautiful time. So I'll be talking about COVID-19 and the child with special needs. How do we cope? We've been talking a lot about the challenges of the pandemic. I'm sure we've experienced it personally, and a lot has been said about it. How much more for the child with special needs? The child with special needs is one that requires special attention, some more attention, more than the regular and average child. The child that has mental, emotional, or physical disabilities, the child requires extra care. You can imagine the tension in the family of the child with special needs at this point in time. Talk about social distancing. Of course, that cannot work for the child with special needs. That requires support for daily activities. If you need to carry the child around, you cannot social distance. Then the child with learning disability will not understand all that is going on. That will create a lot of tension. The child with autism that works so well with routines. Routines that cannot go to school, cannot have the therapies, cannot go outside to play outdoors, cannot visit. So the stressors have increased. Therapies have been disrupted. Progress has been stunted, so to speak. Dr. Vera has said learning must still go on. So how do we cope? How do we cope with these stresses? Another stressor is the fact that medical supplies for children with special needs. Normally, they're very difficult to get. How much more with these challenges? It's even more difficult to get. So there are a lot of stresses for families of children with care with special needs. So how do we cope? How can we cope with this? Okay, we number one for the you have to create a routine. Dr. Gary has said that you must create a routine. Yes, they're not going to school, they may not be able to access therapies, but on your own at home as parents, create a routine. You can make a visual routine chart. Time to wake up, time to brush your teeth, time to take your bath, then you have screen time, scheduled screen time, time to play outside, time for breakfast. Make the child understand that there's still a structure. There is still a plan. It's not just let the child be throughout the day watching TV or watching, just playing games. There must be a structure, there must be a routine. For the child with autism, you know that before you transition from one activity to the other, you give the child about a minute notice. We're about to move to this. We're about to move to this. Then you have to educate the child on what is going on. The child wants to know, it's confused. Why isn't mommy going to work? Why can't I go to school? You have to explain, you can even make a picture story about the coronavirus, explain what it is in a way that the child will understand. Teach the child basic hygienic practices that have been recommended, how to wash his hand or her hand, how long to wash her hands, how to wear her face mask when she's going out, and the reason why we are not why we practice social distancing outside. And then then you have to check in with the therapist. Some therapists have online sessions. You can call. Is this available? And how you can make things work. You can also schedule with the therapist. Can you come home? Can you come home, wash your hands, wear your face mask, and do the therapy session with the child? All is not lost. We can still continue our therapy just in a different way. You can also get yourself educated about the child's condition. This is time to actually learn how to be involved in the care of the child. Go to the internet, learn about the child's condition. We know that so many conditions are under the special needs. Autism, ADHD, that's the attention deficit hyperactivity disorder, cerebral palsy, visual impairments, learning disabilities. There's a lot of information about them online. There's the role of the parents. Parents' role is critical in the care of all those children. You can't just leave all the work to the therapist. In fact, the parents' role is more important to me than the therapist. So therapists come and go, but the parents are always there. So you have to find out your own role. How can you help your child at this point in time? What can you do? How can you be of help to your child? And then we also know that caring for a child with special needs, it's a lot of work. How much more the challenges of the pandemic? How can the parents also cope? Parents should learn how to delegate duties. Don't do everything by yourself. Have somebody else that can do some of the therapies for your child. Then also have, like Dr. Etienne said, have a time when you can have a break. Watch a movie, watch a comedy, listen to music, do something else away from the child. Don't leave you. Don't forget about your whole life. Still pursue your hobbies, pursue your career, pursue your source of income. Yes, even with caring for the child. Then we also realize that you can also call in the child doctors. Find out what is available. Don't abandon your child. Some people have stopped the children's therapy, stopped their medications because of the issues on ground. Call the hospital. How can I get this medication? Call to schedule your clinic activities. We have telehealth services right now. You can make a call, find out how can my child continue having follow-up. Because many, our children with special needs, their progress is step by step, little by little. We don't want to leave the progress we've made because of you ought to make efforts, continued effort on what has been done. Don't leave your child where he was 3 months ago. Continue what we've been doing all the while. Then other things you can do to cope. Ensure that your child is not overwhelmed by information about COVID-19. It's already creating fear in the average child. How much more the child with special needs? Control the information that your child gets. Don't allow the child to spend all the time on the CNN, internet, getting all the fearful news. Control what the child gets. At this point in time, to be empathetic to your child, show your child love, help the child understand that you understand that it's a trying time. Be patient with your child. Don't snap at your child at every opportunity given or every little thing. tell your child that you love your child and you understand that it's not easy at this point in time. Be empathetic, be patient, and it will be more tolerant. It could be very annoying and could be very stressful at this point in time. But be in charge of your emotions, be in charge of the environment, and don't allow it all get to you. These are some of the things that I think will help us cope at this point in time. Thank you.
Thank you so much, Dr. Olondam. And I think you have addressed the question that somebody had dropped earlier. Precious Adebisi, I hope this has addressed your question, your concerns. Okay, thank you so much. So I can't see any other questions so far in the chat comment section, and we'll encourage you to ask your questions. These are very well-trained, skilled doctors doing very great and marvelous things in their fields. This is your opportunity. ATP is bringing it to you for free. You would have to pay some decent money to see these people, and it's here for free for you. So ask all your questions now. So while we wait for questions to drop, I have a question for Dr. Vera. How does this impact extracurricular activities? Being that, so for those, I'm aware that some children go on to have sports scholarships because of their sporting capabilities in school. Now that they are all forced to be home, so play and other extra field and sporting events, how does this impact that aspect of their life? Because it's part of education, I believe. Dr. Vera.
I didn't get that question, Dr. Uche. You're asking that children
So
don't
how does this
don't play football and all that anymore. Is that what you're saying?
Yes. So, some people go on from school to go into some professional sporting activities, and certain schools encourage that. Schools create those platforms. Schools provide academies for certain sporting activities.
Yes.
And they go ahead to channel those children, because education doesn't only have to be a formal class education. So how do other forms of education get affected, or how have they been affected in this pandemic? However,
well, like I said, professionally, I'm sure that.
Go ahead.
Can I go on?
Yes, please.
Right. Okay. But I only got the question about football and other games and sporting activities. Well, yes. While they may not be able to play football professionally, I think a footballer will still play football in his house. My children still play their football in the compound. They're in football club. Well, not with their friends, but they still will not lose the skill. So it's something, like I said when I was speaking, that we should also encourage play. There should be time for outdoor play. If you are fortunate enough to have a house that has a compound, oh, perfect. So your children can still ride bicycles. I did a challenge recently, and I found that many people started doing stuff that they were not thinking of doing before that challenge. So they started playing football, riding their bicycles. So you can play a football in your compound. You can go ride your bicycle on the streets for those who live in safe environment, really. Then you can actually walk. So children are still doing the things that they want to do. But I think for us as parents, we shouldn't be too careful not to allow our children breathe fresh air. So once in a while, allow them go out. But even the what's that thing called now? Premier League stopped. So definitely it affected everybody. Definitely there is no professional, as it were, going on now. But I think with time, since it's an outdoor thing, maybe, just maybe, but I don't think it will kill anybody to stay at home for now and play the football in your compound with your brothers and your sisters and those in your own household. It won't kill for now. But definitely it has impacted them. But a footballer is a footballer. Play on your field and watch football. That's what I will say.
Thank you very much. I think you have quite addressed it, and I think the message is mothers should continue to challenge their children to develop in areas that they have identified are their strengths, no matter how little. And that is what I've got from you. Thank you so much. Dr. Bamiboye is back. So you are
so
sharing
sorry for the break.
interesting insights to us. People who are interested. Some people are screaming. Some people have screaming Holy Ghost fire for the internet disruption. So we are happy to have you back. So thank you. Please, can you continue
Okay.
from where you left off?
So I was on the preventive and anticipatory measures to take for prevention for home accidents. And I did mention that home accidents or home emergencies. I did mention that we need to do home safety checks. The next thing is that we need to make sure we promptly assess care when symptoms are noticed. Not wait till the symptoms advance and you have to start rushing in an emergency. So your child is having some symptoms, it's better to assess immediately. And presently we have the advantage of telemedicine. So you don't need to leave the comfort of your home or go to the hospital if your child is having some symptoms that are mild and there are no danger signs. You can actually speak to a doctor about your concerns about your child, and it will be addressed by telemedicine. The next thing is have a first aid kit at home. If you don't have a first aid kit at home, you need to go and get one. And your first aid kit will be the usual things, but it should include appropriate medication that is based on your child's medical history. So if you have a child that is asthmatic, you need to know that the inhalers must always be at home so that you are not running helter-skelter. The next anticipatory measure is that now more than ever, we are talking about the new normal. We need to start giving parents and caregivers cardiopulmonary resuscitation training and basic first aid training, so that when things happen at home, they can be the first responder for their children and they are not left clueless. So there are organizations that do this training, and mothers may want to avail themselves of it, so that you know that when anything happens in your house, you're able to do your CPR and you're able to give basic first aid to your children. The next thing is that you must make sure that you have important phone numbers for emergencies, including your local ambulance and including even your neighbors' numbers. There are times emergencies happen and it's just your neighbor going to be your way out. So have important phone numbers documented so that even if you are not home and something happens, your children know the numbers to call, they know who to call for help. And then the last thing that is anticipatory is that we need to start giving our children a lot of safety education, especially safety education in the home. And not only give them the education, we need to leave it out for them. So you need to be able to tell your children the dangers associated with coming to the kitchen. Let them know that they should not be in the kitchen unless it's absolutely necessary. Let them know it's not good to just be running down the stairs anyhow before they miss their steps and fall. And because children can easily get distracted, they cannot anticipate dangers, they do not understand, they interpret things separately. We need to make sure that we emphasize safety education for our children. So now when there's an emergency, the next thing a primary caregiver, whoever is there, needs to be able to do is you must be able to assess danger signs. These danger signs are things that tells you that this is not something that can be handled or managed at all. For example, a child falls down and you find out that after the fall, the child is withdrawn, the child is not alert, the behavior is not normal, is a danger sign. When you have a child that is unconscious or there's no response when you are talking to the child, or the child is not crying as he usually does. When you have a child that is having a seizure or a convulsion, when you are seeing a child that the breathing is not the normal breathing the child has, so increasing effort of breathing, difficulty breathing, or even reduced breathing. When you have a child that the skin or lips are looking blue or gray, as the color has changed. When you have a child that is having increasing or persistent pain. When a child falls down and there is a cut that is very deep, especially when you have it to the head, the chest, or the abdomen, it tells you that you need to take important steps. It's not something you can deal with at home. If you have a child that is bleeding, you have applied pressure for about 5 minutes and that bleeding is just not stopping, you need to be on your toes. A burn, a child gets into the hospital and, for example, hot water pours on the child and it involves the hands, the feet, the groin, chest or face. These are areas that could have contractures and other things, or could be associated with inhalational burns. Those are danger signs. Any child with loss of consciousness, worsening confusion, vomiting or headache after a fall or head injury poses a danger sign. And when you see this, you need to alert your emergency care service immediately. If you have a place where the ambulance comes in, please call your ambulance service to pick up your child, so that it's better they pick up the child than you running helter-skelter. But in a situation where there is no one to pick up the child, it just tells you that you need to get to the hospital as soon as possible. So parents have to learn how to assess danger signs. When something happens, look beyond, oh, this child fell and got up. Okay, he's sleeping or sitting quietly somewhere. Be sure that that child is actually conscious and there's no danger sign associated. Okay, so what are the general tips? What do you do in an emergency? The first thing, which is very difficult to do in an emergency, which is important for all emergencies, is to stay calm. And it's very difficult to do. But you have to stay calm, because at that point, somebody has to think and somebody has to know what to do. Stay calm and call for help or assistance. The help can be in form of a neighbor. The help can be your emergency numbers. Call for assistance. It might not be something you can handle alone. If you have the ability to do a CPR, if the child is not responsive, the child is not crying, the child is not breathing well, you may need to start that. Or if you have somebody around that can, they need to start that. You may need to give rescue breast to your child, and please stay with your child till appropriate help arrives, or move the child to the hospital if appropriate help cannot come to you. So I've mentioned the general tips. I'll just give some tips for some home accidents or home emergencies that could occur. So your child suddenly starts convulsing. Maybe the child had a fever and the child is now convulsing. Like I said, please stay calm. Put the child on a flat surface, either on the floor or on the bed. Turn the head and body to the side so that the child does not aspirate. Please do not put anything in the mouth. The thing is, most convulsions will abort by themselves. But if it's not aborting, still trying to maintain the child in that position, move the child to a hospital where something can be given to abort the seizures. Your child has a fall and has cuts or bruises. If the child falls and is not able to move, like I've said, assess for the danger signs. Is this having pain? Is there deformity in any limb or deformity in any area? If you think that there's a deformity anywhere, look around to be sure there's no danger. If there's no danger, leave the child. But if there's danger around you, please move the child to a safe place. If there's bleeding, apply continuous pressure to the site of the bleeding, and then try to get the child. If it's a small cut, you could do your first aid at home by cleaning with an antiseptic and applying your sterile gauze on it. But if it's something that is more than that, please get to the hospital. What do you do when your child has burns? Please, when your child has burns, you can place the affected area under running water for about 10 minutes. And then cover it with a sterile gauze or bandage. Please do not puncture the blisters that forms. Do not apply any of the local things on it, because you're going to put those things at risk of infection. And if, for example, the burns is from a fire and the clothing has stuck to the injury site, please do not tear up the burn clothing. You are going to convert the burns from mild burn to something that is more severe. Another thing in the house is poisoning, and prevention of that is part of keeping our home safe. So all medicine must be kept out of reach of children. All chemicals that are used at home, including detergents, including cleaning agents and all, should be kept away in a locked place. We always advocate that you keep all these things in their primary, the containers that they came with, and do not store them inside containers that have been used to store food. And also, we advocate that you don't call medicine sweets for your children. So you want your child to take drugs, and you're saying, take it is sweet. It's a dangerous thing to do, because the child is going to be seeing medicine as sweet, and the child can actually take some drugs and have poisoning from it. When your child, another thing is choking. Some children could choke. And for this, we advocate that, I'm sure when we buy toys, we always see that they write age on it. This toy is appropriate for this age. This toy is appropriate for this age. Because some of these toys actually have small particles that children could choke on. They could choke on beads. They could choke on buttons. They could choke on so many things. So we need to keep these things away. And if it does happen, what we advise is that if the child is coughing, encourage the child to cough as much as possible. If the child coughs as much as possible, the likelihood is that they will dislodge that and bring it out. Otherwise, one is advised to do what we call the helmet maneuver. The helmet maneuver is something that will be demonstrated if you have gone to the first aid training and all, so that you know the exact thing to do. So baseline, what we talk about is home emergencies, why it happens, why it may be more predominant now or more common now because the children are just at home. And the things that we need to bear in mind, danger signs means get to the hospital fast. And I want to assure that most of the hospitals have put things in place to ensure that they reduce the risk of contracting COVID-19 when you get to the hospital. So please don't see danger signs and keep insisting that you're afraid of going to the hospital. Go to the hospital as necessary. Apply the first aid you can at home as you have been told. And please, parents, we are encouraged to have training in CPR. We are encouraged to have training in basic aid so that when our children have injuries, they have accidents, we can address it. Also, the prompt management of fever will help to reduce the incidence of febrile convulsion. So, at the first sign of fever, please get a consultation, let the doctor know what is wrong with the child, and let the child be treated. And I've told us that we have the benefit of early medicine at hand now, and so this can help go a long way to address our concerns as quickly as possible. Thank you.
Thank you so much, Dr. Bamiboye. So to recap again, for those who have just joined us, Dr. Bamiboye has been talking to us about handling home emergencies. And she has mentioned hidden dangers. One would think that, like she said, the home is the safest place. But then all those sockets that are open, all those buckets of water that you have left by the side, these children can drown in them. And she has also mentioned hesitancy to visit healthcare facilities because of the current pandemic. So you rather stay at home. Please, parents, pay attention and do what is right. And the key things she has mentioned is that prevention is key and that anticipation is also quite key. So make the place safe for the children. And she mentioned convulsion as one of the common emergencies. Mothers, aunties, sisters, daddies. If I catch you, put spoon inside a convulsing child or burn the leg with fire, we will send you to the Nigerian parliament. You can go and faint there. Please, in the name of God, like she has mentioned, don't run heketa seketa. Just stay calm. Stay calm. Stay calm. Put yourself together. Put the child in the right position and take it from there. Because when you start running heketa seketa, like they say, you get confused and you do things that you shouldn't do and put the child in more harm's way than the child would have been in the first place. Thank you so much for that very educative, very informative session, Dr. Bamiboye. Angela, are there questions for any of them? Are there questions for us?
Yes, there's a question here for Dr. Vera, and it's by Precious Iyebiye. Please, what about children with special needs? Online teaching is a no-no. The parents don't even know where to start with them. They need a special teacher therapist. Please, how do they go about this? The question is from Precious Adebisi. Dr. Vera,
Yeah,
over
I
to you.
think Dr. Olonam has answered the question already. Dr. Olonam has answered it already, but I'll just say one or two things. The question already has an answer. So beyond getting a special teacher, you as a parent, go and read up on how to teach your own child. Because when we talk about special needs, we're talking about different aspects. We have dyslexia, we have autism, we have ADHD, we have a lot. So which one are we talking about here? Like Dr. Olomam says, you need to be patient. For a dyslexic child, for example, instead of giving a child too many notes to read or too many notes to copy, give the child pictures. Let the child enjoy watching pictures, picture reading. At the end of the day, what we want to achieve is learning. So you need to look for what is suitable for your child. And yes, like you said, you need to get a therapist to support you. Because if you don't know what to do, you might worsen the situation more. But what one word I want to leave with you is that you need to be patient with your child. and understand that you mustn't compare that child with someone else. As a teacher, one of my key goals would be that I try as much as possible to move child A to the next level. I would not compare child A with child B. So you see that child you have, you need to patiently reiterate teaching. If you have to teach 10 times, explain 10 times, play with the child, dance with the child, help the child stay with routines. You don't expect a child after eating, dancing, jumping, and then it's time to, he's so excited, and then you say, okay, come and sit down, let's read. You need to understand the child and understand when the child is ready to learn. I mean, you are not just going to do the same. If you have two children, one who has special needs and the other who doesn't have a learning difficulty, you can't put them on the same routine. So as a parent, you need to understand your child, get a therapist, and let the therapist see you through. I believe you'll be able to succeed. But the key word, patience.
Thank you so much. Any other questions so far? Okay. None?
There is none. Yeah, none.
So can I ask that Dr. Rotimi?
No, I thought I saw a question. I thought I saw a question. Are we missing out something? On Oluwa Lanke or something?
That's correct. So how do I help? I think she said she has two children. One is 3 years apart. They are 3 years apart. Is that correct?
Okay, so her question, the first one says, I have seen all the flaws in my children this holiday. My older child has to be told what to do most of the time. How do I help him focus, especially with a 3 year age disparity between him and his brother? And he feels bad when his brother is playing and he has to work.
Dr. Lona, can you help us answer that question? Dr. Lona, are you with us?
Do you want me to take that while we're waiting for her?
She appears to be talking, though, but we can't hear her.
Okay, maybe she's yourself, okay. Maybe she needs to unmute herself. Yes.
Yeah, it's better now. Yes.
Okay, can you
go
hear
ahead,
me?
Dr. Olona? Yes, we can hear you.
Okay, you said how do we help the older child focus?
Yeah.
Yes. Okay. The two children are different. The other child is coping easier, and I'm trying to understand the question. It says.
Okay, let me take that again, ma'am.
Can you repeat the question, please?
Yeah,
I
have seen all the flaws in my children this holiday. My older child has to be told what to do most of the time, right? How do I help him focus, especially with the 3 years age disparity between him and his brother? And he feels bad when his brother is playing and he has to work. So maybe there's a 7-year-old child and there's a 2-year-old child. The 7-year-old has to do his or her schoolwork, and the 2-year-old is playing around, and then the older one is feeling bad. How will she help the older child?
Okay, so what we need here is a lot of communication with the older child. You have to sit him down and let him know, yes, he's older than his brother, and he has a different character, a different learning pattern from his brother. You have to have different schedules, different learning plans for both of them. They can't have the same plans because they have different strengths. So we have to focus on his strengths, encourage him, help him know when he's doing well, praise him when he has done the right thing, and then you can even reward positive actions. And then basically communication, help him understand his own personality. Now he's different from his brother. Don't compare both of them. Don't even let him compare himself with his younger brother. Help him know that he's older, he's different, he has more things to learn. So he shouldn't be comparing himself with his younger brother. Then be patient with him. He's different from his younger brother. He has different needs. So focus on his needs. You've already identified the challenge with him. So you have to work on that. let him understand that this is his weakness, and then we can work on it. And when he does well, please praise him and be patient with him as well.
Thank you so much for that. If we all remember when Dr. Vera was talking, earlier, he talked about knowing what works for each child and what works for you at the beginning of the presentation. So in essence, it is the uniqueness. Every child is unique. Thank you so much, Dr. Olonam, for that. Dr. Vera, please, I have a request to make. When this session is over, Angela will come and meet you and pay you, because 7 minus 2, as I am aware, is 5.
I was wondering too. Okay, sorry, can I just add something to that, to this question? For this mom, I would also assume, if she's saying 3 years age disparity, and then let's just assume it is 7 and 4. So I do not think that one should be playing and one should be working. Every child should have their level of work. There is age appropriate. Aside everything that Dr. Olonam has said, Lualanke run with it. Also ensure that everyone in your house is responsible. Even the 2-year-old child is responsible. Help that senior one model. Let that one know that you are the older one. If this senior one has to carry 3 tables, you help your younger one carry 1 table. The job is not for just one person. So you need to balance that out. And I'm glad for you. I'm happy for you. I like your first question. I mean, your first sentence where you said the pandemic exposed your flaws. And that's fantastic, or the flaws of the children. For me, that's supposed to be a good thing for you. So I think that you don't want to waste this opportunity. You want to do everything that Dr. Olonam has told you to do. And you also want to ensure that everyone is responsible, no matter their age. But let it be age-appropriate task for each one of them.
Thank you so much. Dr. Rotimi, we'll come to you next. Can you talk to us about domestic violence? I have heard that it seems to have been on the increase, domestic violence in this period. And you spoke to us about mental health issues. And I understand that, mental health issues can trigger people into domestic violence, inability to cope with the situation. Can you speak to domestic violence, how to prevent it, how the pandemic has affected the apparent increase in domestic violence, and how to cope with those situations?
Okay, thank you very much. Like I said in the presentation, we have had increase in the number of the mental health issues during this COVID-19 period, partly because people are not used to be restricted to their homes. And this is a new thing, like some of the things that we see in the social media, that men that normally leave home, with their wives, not even knowing where they have gone to, now their wives can know where they are 24/7. I think it's because they have not been bonding, due to hustling. Let me use that language. Man must survive. Most men are out there, to make money most of the time, and the amount of time they spend in the house is very little. But during this pandemic, they have all the time to spend in the house. It's as if people are just getting married newly, getting to know themselves newly, as a result, because of the differences that they are experiencing during this pandemic. It has led to a lot of other issues like the domestic violence you mentioned. You will agree with me, even the issue of child abuse and rape cases have increased. We have had many, even on the, many even that are so emotional, on the TV in these last few months of this pandemic, because people have been engaged at home without having anything much to do. So that has led them to be, that has led to increase in the number of these domestic violence, rape cases, child abuse, and so many others. But the ways to cope with this are part of the ones that I mentioned also earlier, the coping strategies, like they getting themselves engaged. People can even do challenge. Like I think there's a doctor on the Facebook that does press up challenge for 25 days, 25 press up, for 25 days. Those things take, get people engaged with something instead of going to do those things, that are harmful even to themselves and to the society. People need to get themselves engaged, do so many other challenge exercise, even is it dieting, and men also have to get involved in the domestic issue because we have always been out to go to work, to go and make money in quotes. But now that we have been trapped at home, men should help at home so that they will get engaged, because it is a known thing even in the Christendom that devils find work for idle hand, which is what is happening. People are not engaged. As a result, they are doing the work of the devil. So with these coping strategies that were mentioned, I believe the incidence of domestic violence, rape cases, and child abuse will definitely reduce. Thank you.
Thank you. Excellent. Very apt.
Thank
Um, eh? There is noise is coming from somewhere. Okay. Thank you so much.
Okay.
Good. In the absence of another question, I thought I saw something about fear, but it has disappeared.
I saw that the question is not meant for this.
Okay.
Yeah.
Okay, that's fine. So, can we hear from Dr. Bamiboye about supplements currently so I have heard some mothers say that their home diet have become very monotonous because they find it difficult to access food, appropriate food, or appropriate variety. So I've also heard some mothers say they don't let their children outside. So sunlight is eliminated children don't go outside and don't receive any form of sunlight. I've heard some mothers say that. What would you advise mothers in terms of appropriate nutrition in the event of this, in this whole situation, including supplemental vitamins? Do you think they're necessary at this point?
Okay, thank you. Well, funny that you are asking me that question, because I actually had a boy that I had to manage for hypocalcemia because they have been indoors for almost 4 months for the pandemic without any exposure to sunlight.
Wow.
So the child came in with having the hypocalcemic seizures, and that to be managed. Well, mothers saying they cannot, it's still easy to access a wide variety of food. Maybe the purchasing power, but even if you don't want to go to the market, you have a lot of online stores now. Anything you want to buy can report at your doorsteps
Online.
if you check it online. However, putting that in mind, you could have times to designate for you going out to shop, buy fruits, and buy a lot of things. Then on the issue of sunlight, I will advise that even if we are saying there's a lockdown hall, have time for the children to play outdoors with supervision. They can come out with their protective things. They might not be playing with another family, but let them get exposed to the sunlight. And yes, the role of supplements can come in, especially if you are not you are not giving the children a wide variety of foods that will give them all the nutrients they need. However, even if you give some of them some of these nutrients, like the sun now is needed for actually metabolizing something. So that role is still needed. So please, let's make sure we bring the children outdoors at times. Let them, you could have a compound, let them stroll, let them with their plan hall, observing social distances, let them take in the sunlight, let them have fresh air. Don't let's just keep them confined to a space, because it could also get them restless and they are going to be trying a whole lot of things. So supplements could come in handy, especially when you think you are not giving a wide variety of food. But please, let's endeavor to make sure that we still diversify what we are giving our children. It is possible and it is doable. Thank you.
Thank you. Where is my pig milk? Oh, Shebi still has calcium. Angela, Shebi pig milk
Yes,
still
it
has calcium.
does.
I need to drink
It
my
does.
pig milk, yo. Eh?
Yes, so
Hey, interesting. Thank you so much for that. Dr. London, please can you tell us about, so still on nutrition and malnutrition then, can you tell us about the impact of this now on sedentary lifestyle? Children are no longer going to school. There are restrictions in movements. How does it impact? How does this sedentary lifestyle, including posturing? So some of them are on their phone like this or some form of device with their neck bent the whole day. How has this impacted on that, this whole pandemic? Hello, can you hear us? Is Dr. Landa with us?
Thank you very much,
Uh-huh.
Dr. Nini. I don't know whether you've observed around the children this is. I can hear you. Sure, I can hear you. Thank you for the question. I was saying that I don't know if you've observed the children around, they become so big. There's a lot of obesity around. Children coming to the clinics these days, I can't recognize them. Just 3 months at home, they double their weight, they triple their weight. There's been a lot of inactivity. So that is going to be a challenge. And I think mothers at this point in time, we should ration portion sizes. They're not doing so much physical activity, so they can't eat as much as they were eating before. Ration their portion sizes, minimize it, and then, like Dr. Latomi said, let them have physical activity. Let them have time to ride their bicycles in a park where there's no crowd. Yes, they can play football in the compound, they can ride their bicycles, they can run around, they can do press ups, they can do sit. Don't let them just stay on their phones bent over for hours. There should be screen time to be supervised. We've always said that screen time to be supervised. Don't leave your child on the TV or on the phone throughout the day. That's dangerous, especially for a non-verbal child who is still learning how to develop speech. The child is learning how not to talk because he's just watching the TV throughout the day. He's not interacting with anybody. The speech will be definitely delayed. So please supervise the screen time. 2 hours, 3 hours, then take a break, communicate with the child, read to the child, play with the child. Don't leave your child just left on his own, doing his own thing. Please supervise children. Please supervise the children. Thank you.
Okay, thank you so much. Very interesting discuss again. So you have talked about rationing portion sizes and encouraging activity. There is a question on the comment section for Dr. Bami Boje, specifically for you. Please, should mothers give palm oil to children to drink when they swallow a substance? Ha! They seem to want to do that as well. They are those of them. They're heading to the parliament too. Dr. Bami Boye, please answer us.
Palm oil.
Thank you.
Please
Yes,
do
sir.
not give your child palm oil to drink when they swallow a substance. In fact, there are different, when it comes to poisoning, there are different ways of handling each. There are some that when you give all these things, that if, for example, let me even talk about the palm oil. You give a child oil and then the child starts vomiting, and what could have just been a mild thing becomes a severe thing because the child vomits and aspirates the palm oil. So you are not going to have a more severe pneumonia because of the palm oil that has gotten into the lungs. So please don't do it. Different things have different ways of being addressed. There are some you can induce vomiting, there are some you mustn't. But even if you will induce vomiting, please don't give palm oil. Because if the child aspirates that palm oil, that child could end up in the ICU because of what we call lipoid pneumonia. So please don't give palm oil. You have a phone of any doctor near you, call to find out. Some of those drugs actually have leaflets inside, and the leaflet will tell you what to do in case of accidental ingestion or overdose. Please, let's endeavor to always read the leaflets of our drugs and to see what it says before we do anything. And if you are in doubt, please speak to a doctor. Thank you.
Thank you very much. I feel like bringing out the teacher in me, the teacher one joke in me, and telling all the mothers, hold your ears. I shall not do palm oil. I shall not give. What else do they give? Urine oil. I mean, cow urine.
How
Kerosene,
urine concoction.
I
engine
shall not
oil.
give. What else? I shall not put onions. I shall not give onions. What else do they give? Mothers, hold your ears. So I am a teacher for today. Dr. Vera has empowered me for this session.
I shall not get what
To
else?
pull
I
your
shall not
ears.
get onions.
I shall not put
Not eat
onions.
onions for today.
Good. So the Ten
Dr. Vera
Commandments of
has empowered me
ATP fifth
for
anniversary
this session
is coming out soon.
to put your ears. I shall not
Thank
put
you very
onions.
much. So, Dr. Vera, I have a question for
So
you.
the Ten
They seem
Commandments
to
of
just be enjoying. They seem to just be
Thank you very
enjoying
much. So I
the.
have a question for you. Since these people, they seem to
I'm
just be
hearing an
enjoying
echo. Is
everything.
it from
Dr.
my side?
Uche,
They
you're
seem to just be
echoing,
enjoying
yes.
Yes, I'm hearing the echo myself. I
Are
don't know
you
why.
using two devices?
No.
Yes. Yes, I'm hearing the echo myself. I don't know. Are you using two devices? No.
Is it better? Yes, I think it's on.
Yes. Yes.
Okay,
Yes.
good. Okay. So, Dr. Vera, I have a question for you. So, back to school.
Okay.
Is it better?
So some people feel that, or what is the
Yes.
opinion, or what is the right
Yes.
thing?
Yes.
Does
Yes.
competition challenge? Does
So, Dr. Vera,
competition
I have a
challenge
question for
children to learn?
So
Because
back to school.
being that they are not in school, that
some people feel
competition or that
that
challenge they get from
or
their
what is the
other
opinion or what is the right
from
thing?
other
Does
kids.
competition challenge? Does competition
So
challenge?
how
Oh.
does this affect?
Dr. Uche, you're still echoing.
Okay, I think I got that question. Dr. Uche, while I would not personally would not like to use the word competition, I think maybe you mean social interaction. I'm talking to my friend and then we are having a nice time in class. I'm answering a question. Is that what you mean? Or do you mean the competition of I came first or I came second or I came third, something like that? Is that what you mean?
So I think I mean more of the social interaction, like so you put it in a better perspective.
Of course. Social interaction, of course, it's an encouragement for learning, and so that's why those who are very who are rich enough, schools who are rich enough and can do the Zoom, the Google Classroom, the Hangouts, and all those. Oh, they're having a nice time because still the children are still interacting with themselves, although at not I think it's just a manageable level, better than nothing. However, those who still have the WhatsApp class, they're still doing. I think somehow, this is not the ideal. This is not what we want. We would have preferred that there is social interaction. That I prefer that children are in class doing what they're supposed to do. But because of the situation we are in right now, we just have to. It's called the lowest hanging fruit. That's what we are all plucking because if we need to. If we need to get the best, then in quotes, the best means we should get back to class and then we'll do our online classes. That's what they call blended learning. That would have been a better option. But if we don't have that, since we don't have that, we'll just manage and make do what you want. But to answer your question, absolutely, social interaction is very key in education, and it's one of course it does encourage teaching and learning.
And it's one of course it does encourage teaching and learning.
Thank you so much. Thank you so much. Okay. Any questions?
Yes, there's a question in the comment section.
Yes, there's a question in the comment section.
It says, what about a child that is not used to playing outside and tends to get tired of phone time or TV time? Also, speaking about supplements, can a child be on a constant use of supplements?
Sorry, there's echo. I didn't hear that, so I don't know how to direct that.
There's echo. So I didn't hear that.
It's a two-part question. The first one says, what about a child that is not used to playing outside and tends to get tired of phone time or TV time?
Okay. Dr. Olonam, are you happy to take this question for us? Since you still have things to do with neurodevelopment, you and Dr. Vera are just
this question for us.
responding the questions and the answers.
Okay. Child that is not used to playing outside. I think, can you hear me?
Yes.
Yes, we can.
You can.
Yes, we can.
I think this is an opportunity for you to teach the child outside. That's part of development. You can start a new game how to play the ball, how to ride a bicycle, how to run, how to. When it's tired of phone and TV time, you can play outside. It's a new thing you can learn. But apart from that, you can look at a picture book. You can read to the child. Yes, you can do other activities. You can, if it's a child that is up to 5 years, you can take the child through Monopoly. You can learn different games. You can do arts and crafts. They can do chores like Dr. Learning doesn't have to be, learning can be any way. Child can wash the clothes, can sweep the house. Age appropriate activities can be done. There's so many things they can do. There are so many other things they can do. Then you can have scheduled times to actually go out with protection, with some form of protection. You can go to the mall with your face mask. Yes. You can take a show in your estate. There's so many other things we can do there. There are a lot of activities. You can be creative. You can go online. There's so much information online about how to cope right now. You can do that. Thank you.
All right, thank you, Dr. Olonam. In essence, what you're saying is change is the only constant. If this is not working, you try something else. So there's also a follow-up question. And it says, speaking about supplements, can a child be on a constant use of supplements?
Can a child be on a constant use of supplements?
Okay, so Dr. Bamiboye should have taken this, but since she's not around, Dr. Lonam will.
Dr. Bamiboye should have taken
Again,
this,
Dr.
but since
Lonam, I
she's
also
not
want
around, Dr. Lonam
to beat the question
But
the
then
two
Dr.
children.
Lonam
This child having difficulty
the question
getting outside, it's possible that there's an underlying disease. That is not just that the child doesn't want to play outside, but has something that's hindering that play, say a brief cardiac lesion.
That we see a cardiac lesion.
Okay. If that is the case, the child cannot play outside. The other thing, like I mentioned, that you can do indoors. There are indoor games that you can engage in. My children are enjoying Scrabble, Monopoly, chess. Right now, they've learned all these three. They can do that. Arts and crafts. Girls can learn crocheting. They can learn music. They can learn how to be creative arts. They can create things. There's so many beautiful things online. If you just search right now on what to do to keep the children busy, arts and crafts. They can learn an instrument that they've not learned all those while. Things that they can actually do right now. Then you can actually take the child outside if he needs assistance in his wheelchair, whatever it is. You can go outside and have some fresh air. We said that it's very important to expose the children to sunlight. So yes, you can take the child outside just to, be exposed to sunlight. Then you can even watch other children playing. You can find something. You can be creative enough to find something that the child can do outside the house as well. Thank you. Then for the supplements, that will now depend on the particular supplements you're talking about. What supplements are you talking about? There are some that you can't keep the child on for a long time. There are some that prescribe for just a little while. If the child has low calcium level, the child is on calcium supplements just for a while. It's not forever. Because you still have to check if the calcium levels are normal. Then diet can continually supply the remaining whatever is required. There are other supplements that shouldn't be every day. In fact, you should just check with your doctor. Don't, because there's so many different supplements. There are so many. I can't say there's no blanket statement for them. It depends on what you're talking about. You check with your doctor. Thank you.
Thank you so much.
Thank you
There
so
is a
much.
question about wearing face mask.
There is a question
Are we
about
ever going
wearing
to
face
stop
mask.
wearing face
Are we
mask and
ever
social
going to stop
distancing?
wearing
Dr.
face
Rotimi,
mask
before
and
you
social
answer, let me
distancing?
cover my own
Dr.
face with my
Rotimi, before you
dinosaur
answer, let me
face
cover
mask
my own face with my
so that you don't.
face mask
So go ahead.
so that you don't. So go ahead.
Okay, I guess the question is, are we ever going to stop wearing face masks?
I guess the question is, are we ever going to stop wearing face masks?
That's correct. And
Okay.
social
That's correct.
distancing.
And social
Okay. Yeah.
distancing.
Basically, the stage we are now is the community transmission, the community transmission of the coronavirus. And since it has been established that is a droplet infection, when we are with our mask, we reduce the spread. We reduce the spread of the virus into the air.
We reduce the spread of the virus into the air.
Of the virus. That means those that are infected, we reduce the spread of the virus into the air. So that's the basic aim of the mask. It's more or less like a barrier protection. That's why they have given us, they have lowered the standard that we can go out with the one made with clothes, with different kind of fabrics instead of the surgical face mask. So it's more or less serving a barrier purpose. But for those that have to go to the hospital or visit those that are ill, those one we need to wear the surgical face mask, in which that one will be to protect, to prevent or protect against the virus. But the one made with fabrics is just to serve as a barrier purpose so that the thing will not continue to spread in the community. I'm sure by the time we get to the plateau that we are trying to get to, and the disease is coming down in the community, we'll be allowed, to stop using the face mask. But at this stage, especially for those of us that are in Lagos, the rate is still very high. The numbers they are getting on daily basis is still alarming. That's why we still have to stick to the use of this face mask, at least to serve as a barrier purpose. But in the hospital, we have to wear the surgical one, like I said, because most people that are ill, they may not even be symptomatic, but they may be carrying the virus. So those ones, one, we need to wear the surgical face mask. But very soon we get there. We get there very soon. It's just for us to be patient. We get there, because it was even worse than this some like 1 or 2 months back. But we definitely get there. Thank you.
Thank you very much. These Colombian drivers shall not drive us away from our country.
Amen. Amen.
Okay. So on that note, Dr. Rotimi, can you give us your final words? So we seem to be running.
Okay.
There are no questions.
Okay. Yes.
More questions.
Yes.
There's a question
My
that I
final.
think
Okay.
he can wrap in the question with his final word. So,
Okay.
What's the question
on the
again?
children, a question for the parents, the guardians who are now taking care of these children. Before we continue, Dr. Uche, please take a sip of our milk.
Hey,
Yes.
calcium.
Please, can you take a sip?
Yummy. Ay.
Thank you very much.
This one is dragging the Colombia away from me. Dr. Mara, do you want some?
No, that's just for only you. All right, so Dr. Rotimi, the question is this about parents who need to go out every day, and then maybe for grocery shopping or for work, or for example, Lagos with all the traffic, some who don't have their own personal vehicles. For example, Lagos will be shutting down Third Mainland Bridge by Friday. What do you advise these parents to do when they go out there, coming back from work or the market or anything? What do they need to do before they go into the house, or even when they are in the house?
Yes, the medical advice have not changed. The first is to maintain the social distance like those that have to take the public transport, they must make sure that they don't enter crowded buses, and they must leave a space between them and the next passenger. That one has been in place. There is no change. Then they should ensure they wear the face mask, like it has been recommended. They should also ensure they carry their sanitizer when they are going out, or where they have a facility to do hand washing with soap and water. They should also do that. When coming back home, they should try to remove their mask, on entering their respective home. And they should also try to go straight to change, get their clothes soaked in jig water, mixed with a certain portion of jig, and to also wash their hands. The things have not changed. At least before they embrace their children or their family, they should try and make sure they get themselves, sanitized. Let me use that word. Ensure they get themselves clean. In as much as possible, is more or less the basic hygiene, which we have known before, only that we are not doing it. But now, the knowledge is somehow translating, into practice. So that's the stage. That's what I will advise the parent. Then also, as my parting word, this pandemic period is a very stressful period. Nobody likes stress. Nobody enjoys stress. Nobody is happy with stress. That's why we have to engage in several coping measures so that we get, the stress will not weigh us down, will not even make us to be ill, will not even diminish our immunity towards COVID-19. So we need to use those coping strategies that have been mentioned to overcome this stressful period that we are in. Thank you. Happy 5th anniversary to everybody.
Thank you, Dr. Rotimi.
Okay. Thank you so much, Dr. Rotimi. Dr. Vera, do you want to give us your final advice, bearing in mind that a lot of mothers are waiting to go and dump their children back in school? They're tired of those children. You're muted. Do you want to unmute yourself? Dr. Vera, go ahead.
Sorry. Final words, to school owners. Let me start with school owners. I'll just say the future of learning is blended learning now. For school owners, note this, because I know some of us are listening and we own schools. And I want to also encourage school owners to collaborate. Now, these school associations that we always have, association of this school, association of that school, such associations are not for competition. They're actually supposed to complement each other. So this is the right time where school owners come together and form a formidable team, right? That's what I have for school owners. For parents, be sincere with yourself. I've said this before, I can't overemphasize this. Take charge of your child's learning. You are the architect of your child's life, not the government, not the school, not anybody else, but yourself. So you have to take charge of your child's life. And if you want to send your child back to school for whatever reasons, if the government says go back to school, before you send your child back to any school, go yourself and be sure that the school is safe for your child. But I'll just speak for myself. I don't see that coming for my own children anytime soon. But if you think that is the way for you to go, I would advise you that you should actually open your eyes and see clearly. And this is something that as teachers we always observe. Sometimes parents are not so open to telling the truth about their child's health conditions. For teachers who are watching this live show, they would agree with me. So we were told yesterday that if children have underlying health condition is a major issue. So you also want to think about that. You have an asthmatic child, you want to think about that before you let your child go to school. So wherever you are as a parent, my advice for you today is that be sure that you are doing something deliberate every day to ensure that your child is learning. And don't forget that learning is beyond cognitive. You need to teach your children affective and also the psychomotor aspects of learning. Thank you.
Thank you so much. Thank you very much, Dr. Vera. Dr. Olon, now, any parting words for us, especially creative ways of how parents should help special needs children,
creative ways of how parents will help special needs children, particularly.
And other children as well.
Thank you. Talking to us of parents.
And other children as well.
Parents of children with special needs. I want to say that this is a trying time, definitely. But like they say, tough times don't last, tough people do. It's actually an opportunity about the child's condition. Learn about your child's condition. Find out the parent's role in the management of this child's condition. It's time for you to also supervise what the therapists, what they do. Because they could come to the house and then you're present, so you can see what they do and ask them if they should also teach you what you should do as well. Then be patient. Please be patient. Please be tolerant. Don't be impatient, and be patient with your child. This time will pass. Then there are so many apps being developed all over the world right now for children with special needs, especially speech therapy apps that don't require an in-house person. Find out all these things online. Then there are so many groups online too, international groups, national groups that you could also join, support systems for yourself, for your children, to know how to cope as well. So don't isolate yourself. Don't isolate yourself. Find out what's happening and keep abreast of the times. Thank you.
Thank you so much. And remember that as the pediatrician group, which you can find on every social media platform right now, is also a very wonderful support group for mothers. You can learn, you can connect with people who have similar experiences with you and compare notes with each other. Thank you so much for that, Dr. Olonam. Dr. Bamboye, do you want to give us any final words with regards to home emergencies and nutrition? Any final words to parents on this pandemic issue? Dr. Bobby Boy, are you there? She seems to have gone to take a glass of milk. I will take another sip. Is she there?
Yes, she is. She's muted. Her video is static though. Let me see. I think she had a connection problem.
This 5G thing. What shall we do to
Out.
this 5G, 4.5G? Okay.
She's out.
All right. So, Angela, do you want to any words for us?
I'd like to say thank you to all panel members. Thank you for very educative and insightful teaching this evening. Thank you to Ask the Pediatrician also for hosting this. And special thank you to Peak 456. Cheers to Peak 456 for sponsoring today's second day conference. Cheers, Dr. Uche. Our celebration continues. ATP is 5. There are so many things in the group that you can participate in, so many competitions, there are quizzes that are coming up. I think Dr. Bamboye is coming back.
Oh, she's back.
Dr. Olatomi, can you hear us?
Yes, I can.
Okay. Dr. Uche was giving you the floor for your parting words, especially as it has to do with nutrition.
Okay. So what I will say is we talked about home accidents and home emergencies. I will advise that the mothers take note of those things and make their home a safe haven for these children while they have to be at home. And on the issue of nutrition, I want to say too much or too little is bad. So we need to make sure that the children eat a wide variety of things, and let's dwell a lot on fruits, vegetables, and make sure that along with what they are eating, they do have some form of exercise, so that we don't end up producing obese children after the COVID, or children that have been eating junk and have one form of malnutrition or the other. let's ensure that they come outside to have some exposure to sunlight, ensure that they exercise, and let's ensure that they eat well. Thank you very much.
Thank you so
So
much.
just to be sure, is abo part of the vegetable you're referring to?
Agbo?
Yeah, abo leaves. Is that part of the vegetable you're
No,
referring to?
no,
So
no,
that
no.
we don't misconstrue your words.
Dr. Angela, Angela, we're talking to
Vegetables,
the parliament.
efo. I'm not talking about agbo. I'm talking about efo. Things like kuku, vegetables that you make as soup and you eat. Thank you.
We wanted you to be more specific so that ATP mothers
Okay.
will not say you said.
Thank
All right.
you, everybody. Thank you, Dr. Boyede, for this wonderful platform where mothers can learn and share their experiences. Thank you, Dr. Vera, for joining us and giving us your a very insightful, journey in the education of these children. Thank you, Dr. Rotimi, for handling the mental health issues of these children, of families, and the impacts on how to cope. Thank you, Dr. Olonam, for taking us through the journey of the development of children, both normal in quotes, everybody, and the special needs children, and for preferring solutions to all of that. And thank you, Dr. Bami Boje, for providing us with identifying the dangers at home, which ordinarily should be a safe place, but bringing to light that there could be some safety issues at home, how to identify these things and how to handle them. And thank you, Angela, for co-hosting with me, giving me the opportunity to talk, my talk, and five hearts to 1, 2, 3, 4, 5, and a glass of peak milk to ATP at 5. Thank you, everybody.
Thank you so much. Thank you. Thank you. Thank you.
Bye.
Bye-bye.
Bye, everyone. Bye.